Let's talk about the placebo effect. It's really an important mind-body relationship. It ties in with psychoneuroimmunology too. We've all heard stories, especially as physicians, you have people who've healed from cancer, people who healed from arthritis and their allergies and all that, and a lot of people haven't. You know, I remember when I first started seeing when AIDS was becoming active, I would see sometimes a couple, and one had a really kind of down attitude and was really upset about it all, and the other was, I'm going to keep eating good and I'm going to keep working out. And I would see them. I had probably 3 times this happen with two men partners, and one would go downhill and die much sooner than the other. The other would keep their health together. So that, is that a placebo effect too? Maybe. So I think it's important, our attitude. So when I talk about my 5 keys to staying healthy, nutrition, fitness, sleep, stress management, attitude. Attitude is the one, it's like the thumb, it's the core, it affects all the others. Our belief system affects how things work in our body and how our body works. So that's why I'm always encourage people to think positively, give your body a lot of loving thoughts, take care of it. When I did my first cleansing and detox program, 40 plus years ago, I started to feel so good and my allergies cleared up and my inflammation went down. And I was in my 20s and I said, wow, this is how I want to feel. So I realized that I had to start eating differently than I was eating, all the foods I grew up eating. And I had to give up a lot of my habits, the sugar and cookies and milkshakes and burgers and fries and all of the treat foods that I call them now, which, should be a rare experience. But really I said, the shift I made is, this is the only body I have. I'm going to treat it with love. When I started doing that, my body really responded. And that's part of the placebo effect. It's just the expectation you have. As a physician, as a Western and natural-oriented physician, I both give herbs and natural remedies, and I also prescribe drugs. So if I'm going to give somebody a prescription drug, and maybe a strong one, whether it's an antibiotic, an antidepressant, if I'm going to do that, and that's what they choose with me, because I do cooperative medicine where the patient and I decide together what they're going to do, and knowing that the patient is first, and it's their body, and they get to choose it, I'm just going to educate them about the risk versus the benefit, which is the key when you look at any kind of treatment. But if I'm going to give them an antibiotic for their bronchitis, I'm going to say, this is going to go into your bloodstream, it's going to get rid of those excess bacteria. Even if it's partly viral, you still want to use that positive effect. If I'm going to give them any medicine, I'm going to lay it down not with all the side effects that can happen, which is what I used to do when I wanted to educate my patients and be open and honest about it. I'm going to say, this is very likely going to not cause any side effects. It's going to create these beneficial effects, and it's going to get rid of your infection. I find my treatments work a lot better when I do that. Your mind's attitude affects your nervous system and your immune system is carrying through, and your body is just given this direction to say, okay, heal. When I work with patients, I say, if I can get them to shift their attitude, this is the only body you have, who else is going to take care of it if you don't? They may start eating better and exercising and making sure they get sleep and managing their stress and working on themselves to improve their health and really change their overall health and vitality. And that's, to me, key. And use the placebo effect for your benefit.